Sophie. I'm going to be your student nurse today. I'm just going to get a baseline assessment from you. We'll start with some hand hygiene. All right, that was a lot. Okay, can you tell me your name and your date of birth? Wonderful. Just want to identify I'm with the right patient. I'm going to close the curtains and shut the door. And we can begin. I'm going to do a general safety assessment of the room. There's no cords, rugs, or anything. And I am going to make sure you're lowered all the way down for safety. And let's get started. Can you tell me how your mood is today? Good, good. Okay, anything that's causing or affecting it, anything like that? Great, okay. Let's see, I monitored or checked your vital signs, and it does look like your systolic is looking a little hypertensive, but other than that, your vitals look normal, within normal ranges, and that looks great. I am gonna assess your pain scale. Can you tell me what your pain is today on a scale of 0 to 10? 3, okay. I'm gonna do the septic caldera, so what are the characteristics of your pain? Tender, okay, awesome. And the onset, when did your pain begin? Okay, and location, abdominal pain, great. And is your pain like ongoing, or is it kind of on and off? Wonderful, okay, and then let's think about this. Exacerbating factors, anything that makes your pain worse? Okay, does your pain radiate at all? Awesome, and then anything that makes your pain better, relieving factors, and any associated symptoms. Okay, great. Now that I've assessed a caldera, I'm gonna assess your level of consciousness. How are you feeling mentally today? You okay? All right, can you tell me where you are? Awesome, I've assessed your name. Do you know what the date is? Okay, and then can you tell me who our president is? Fantastic. Okay, I am going to assess your eyes now. Let's take a look. I'm gonna go over it. I'm gonna just cover them, and then on the count of 3, I'm gonna shine the light in your eye, okay? 1, 2, 3, perfect. 1, 2, 3, wonderful. If I can have you follow my pen with just your eyes, to the sides, up and down, and we're gonna go diagonal. Perfect, and into the middle. Awesome. Pupils are equal, round, and reactive to light and accommodation. So that all looks great, and our patient is oriented ×3. Can you smile big for me? Great, and can you tell me what your favorite color is? Awesome. Patient has no drooping or slurred speech, and their smile is even. I'm now going to start by assessing head to toe, just going through each part. So I'm going to first inspect your head. Awesome, and I'm now going to feel your head and just make sure that nothing feels abnormal. Make sure those lymph nodes feel okay. Great, not feeling anything abnormal there. I'm going to take a look in your eyes, your ears, your nose, and your mouth. Wonderful, everything looks normal there. I don't see any abnormalities. I'm gonna move on to your chest now. Can you tell me if you've had any chest pain? No chest pain, okay. I'm gonna go ahead and inspect your chest first. Awesome, just trying to give you as much privacy as possible. I'm not seeing anything abnormal on your chest. We'd be looking for any lumps, bumps, bruises, asymmetry, which means they don't mirror each other. I'm now going to auscultate or listen to your chest at 5 different points, okay? All right, first is aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, I'm now gonna listen to your PMI at the mitral spot for 1 whole minute while I listen for your rhythm and rate of your heart, as that's the most strong point, okay? Set my timer. All right. All right, S1, S2 are sound intact and everything sounds great there. Your rhythm and your rate sound strong. I am now going to move on to your pulmonary. So also just going to inspect that chest again. Make sure your rhythm and your rate of your breathing look normal. There's no excessive breathing or excessive effort. And can you tell me, have you had any difficulty breathing or coughing lately? No? Okay. I'm going to listen to a couple of places, 6 on the front and 6 on the back, and listen to those lung sounds. If I can just have you take some deep breaths. I'm going to start by sitting you up first. Right. Make sure that they're kind of covered. Not trying to expose. All right, you ready? All right. Deep breath in. Again. Deep breath in. And here. Deep breath. And deep breath again. Awesome. I'm just going to have you lean forward for me. Strong little one. All right, 6 spots I would do this under normally, but I'm just going to do it over for the sake of undressing. All right, deep breath. Again. Perfect. All right, one more. Awesome. Okay, let's lay you back down. Your lung sounds sound normal. Everything sounds equal on both sides. We'll lay you back down so we can assess your abdomen. Let's cover you up. Okay. All right, let's bring this down just so we can only see the abdomen. Keep you covered here. I'm first going to start by inspecting the abdomen, make sure there's no distension, bruising, discoloration, anything that's abnormal. I'm now going to listen to your abdomen and your bowel sounds and also listen for something called bruits. All right, I'm not hearing any signs of bruits, and I do hear normal bowel sounds. I'm now going to palpate on the bowel if that's, or on your stomach if that's okay. I know we're having a little bit of abdominal pain, so let me know if anything hurts. All right, any pain there? Just a little bit on that side? Okay. All right, and when was the last time you had a bowel movement? All right, any discomfort, pain with that bowel movement? Glad to hear it. Okay. Next, I'm going to assess your extremities and just make sure that everything looks and feels okay. I'm just going to assess them for edema, look at the integrity of the skin, and make sure that that temperature feels right, which it does. The skin doesn't feel clammy or freezing cold or anything abnormal. I'm also going to look for any abnormalities on the skin, things that we shouldn't see. All right, nothing worrisome there. I'm gonna just pinch a small part up here. This is checking for turgor. And your skin bounced back great. There's no tenting or anything going on there. I'm gonna assess your capillary refill. Awesome, that looks great. And I would assess under the sock, but I'm just gonna check here as well. Great, and then let's check your radial pulses. Awesome, both strong there. Same with here. Wonderful, those both feel great. Okay, can you grip my fingers for me? Awesome, and then I'm just gonna have you push against my hands and pull towards my hands. Your grip feels great. Capillary refills, everything looks good there. No swelling, no abnormalities that I'm finding on any of your extremities. I would assess for wounds at this time, which I'm not seeing any wounds on the body that are concerning or need to be addressed at this time. Can you tell me the last time that you had or were able to urinate? Anything uncomfortable or issues there? Okay, great, I'm glad to hear that. And lastly, I would assess for any tubes, drains, catheters, anything like that. And if anything, I would assess their site and location and anything that is abnormal in that area. I'm just gonna lower you back down and do some hand hygiene. And I hope you have a great day.